Hi, Andrea. Welcome to the office.
Thank you.
It's nice to see you again. Today's date is September 1st, right?
Yes.
Good. So I'm just pulling up the notes for this visit. Can you confirm your name and date of birth?
Andrea Gray, December 1st, 1999.
So how are you feeling today in general? Do you have any pain, any concerns? You feeling good?
I'm feeling good, yes.
You feel good? Any headaches?
No.
So I see here in your chart that you are a little bit concerned because you have a lymph node enlargement.
Yes.
Did you had any flu-like symptoms in the past 2 weeks?
Yes, 2 weeks ago.
2 weeks ago. And the lymph node, do you still have it enlarged or it's coming down?
Coming down.
Any abnormal periods, any cramping?
No.
Any scalp issues?
I have itchiness.
You have some itchiness?
Yes.
For how long do you have it?
1 month.
For a month. Did you change your shampoo, your conditioner?
Yes.
You did?
Yes.
Okay. If you have any questions now or during the exam, you can let me know, okay? Seasonal allergies?
Yes, pollen.
Pollen?
Yes.
Are you taking any medications right now?
No.
Any anemia?
No.
Do you know when was the last time when you had a blood test?
1 year ago.
1 year ago. I will give you a referral here at the lab, so you will have a blood test because it's a year, and I think we should do some testing. Okay, so I said itchy scalp. The lymph node. It's on the right or on the left?
In the right.
So right side. You said you had an flu 2 weeks ago.
Yes.
Good. So I'm also going to take a swab to make sure everything is fine, to see if you still have any infection. That might explain the lymph node enlargement. But anyway, I will check overall on your collarbone and here also to make sure everything is fine. Good. So I'm going to start with the vital signs, and I'm going to take the swab like I said, and we'll continue with the exam. Perfect. I'm going to put my gloves on first. And I'm going to swab, and I'm gonna let you the results by the end of the day or tomorrow maybe. So open your mouth. Just relax a little bit more on the cheeks. Okay, relax. I'm gonna pack this and I'm going to the lab. Just wait for me 1 minute here. Now I would like to listen to your heart and lungs. I will put your hair in the back and Take a deep breath in, please. Exhale. One more time here. Exhale. I'm going to listen with the bell for any murmurs. Take a deep breath in, please. Hold it. 1, 2, 3. Exhale, please. One more time. 1. Exhale. Going to listen on your artery here. Just relax. Good. On the other side. Take a deep breath, please. Exhale. Perfect. No murmurs, and you have normal sounds. I'm going to listen to your lungs now. Take a deep breath in. Exhale. One more time. Exhale. I'm going to listen on the other side. Take a deep breath in. Exhale. Perfect. So normal sounds of the lungs. I didn't hear any infiltration. I know you told me you had the flu 2 weeks ago, but the lungs sounds are normal, and also your heart, everything looks great so far. And in the end, I will tell you the results of the swab if it's ready. If not, tomorrow morning. I would like also to take your blood pressure. I know the assistant had the blood pressure taken before, but I would like to take it one more time.
Okay.
Is this okay if I use this arm?
Yes, sure.
Perfect. You can squeeze this arm. So just relax, you can close your eyes. Blood pressure is normal, 125/78. So now it's normal. I saw in your chart that also 2 weeks ago you had a higher blood pressure, but now everything looks fine. I'm also going to take your temperature to make sure you don't have a fever. It's 37.3 in Celsius. I will take it on different places, so just relax and you can close your eyes. It's a little bit hot in here as well. Okay, good. So I will ask you now to change. I will give you a gown,
Okay.
and you can lay down on the table, okay?
Okay.
Perfect. So I'm going to come take a closer look. You do have some wax on the ear wall, but otherwise I don't see any discharge, no infection. Tympan membrane is gray. I'm going to check the other side.
Okay.
Here you don't have a wax, no redness, no infection. I'm going to test your hearing. I'm going to do a few sounds. So let me know if you hear the sounds.
Yes.
On this side?
Yes.
And do you hear them now?
Yes.
Do you hear them now?
Yes. Yes.
Do you hear this vibration?
Yes.
What about now?
Yes.
Tell me when it stops.
No. 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 No.
Good. We'll move on now with the eyes. So just look at me and follow the light. Something funny?
No.
Next, I'm going to check also your pupils.
Okay.
So I'm going to come very close to your
Okay.
eye. Pupils are round and reactive to light. And I heard that you had last time some difficulties reading the last 3 rows.
Yes.
Can you hold this please in your arm, the Snellen chart, cover one of the eye, and try to read the last 3 rows.
L, C, F, F, P, F, P, H,
Next row,
D, A, P,
and the last one.
C, F, D.
Good.
L, T, F, P, H.
Almost good, so you missed 2.
Yes.
You can switch now and try to read this row.
D, H, G, B, S, A, P, T, C, O, C, F, D, H, G,
It's J.
J,
And the last one.
L, T, F, P, H.
Okay, so I don't know what's funny, but you missed a few. So you also might need to see the eye doctor. So try not to delay the appointment, because if you go later, it may be worse for your eyes. It's better if you go sooner and you catch whatever you have. So I might suggest you schedule the appointment as soon as possible, okay? Because you're still young and you want to see what's going on.
Okay.
Good. Okay, Andrea. So I'm going to check your face now, and I'm going to palpate to see if I still feel the lymph node. You said it was on the right side or left?
The right.
So right now I don't feel any enlargement. That was probably because you had a flu, and sometimes our lymph nodes are affected. But also we'll see what the swab will tell us. But right now I don't feel any lymph node that is enlarged. So both sides, the right and left, are even. Any pain around the ears?
No.
So now I'm going to check a little bit your collarbone here. Going to palpate. Put your necklace a little bit up. Everything looks great. Here I don't see any inflammation, and I don't feel anything that should be concerning. Any neck problems?
No.
Checking your neck right now in the front. Perfect. I'm going to check also your face to make sure it's symmetric. Checking the eyebrows, the hairline. Any pain if I do this?
No.
Any pain here?
No.
I don't see any puffiness around your eyes. Color is pink. Everything looks great. I'm going to tap, so you can relax your jaw, please. Just relax, good. Good. I did examine your face. Now I want to check your scalp, and I will also do a few tests.
Okay.
Okay, Andrea, so I'm checking at your scalp. I do see some flakes. You can turn your head a little bit this way. You have also some red patches, but you do have flakes. Is it itchy when I do this?
No.
No? How does this feel like?
Cold.
No?
Cold.
Do you feel a vibration?
Yes.
Tell me when it stops.
No.
Do you feel a vibration?
Yes.
Tell me when it stops.
No. No.
And how does this feel like?
Cold.
And this?
Warm.
And this?
Sharp. Sharp. Sharp.
How does this feel like now?
Dull. 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 Sharp. 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 Cold. Cold.
This?
Sharp.
Okay. You did responded very good to the test that I did. I'm going to examine now your abdomen, your legs, and then I will also check your back.
Okay.
Okay, Andrea, so I'm checking your belly right now. I'm looking for symmetry. Checking your belly button, it's very well centered, it's midline. You said you don't have any pain, any concerns?
Yes.
I'm going to listen first, and then I'm going to palpate.
Okay.
You can relax. Okay. All right. I'm going to check for any bumps or lumps that I may feel. Going to feel the thoracic cage as well. I'm going to do now a deeper palpation. Going to check your ovaries. check the umbilicus. I don't see any redness around, no infection. Umbilicus looks great. Do you have any pain if I do this around?
No.
No pain then. Just want to check the temperature of your belly. It is equal on both sides. I'm going to percuss now. And going to check one more time your skin to make sure I'm not missing any bumps or any lumps. Perfect. Since you are in this position now, I also would like to check the lymph nodes under your armpit. Is that okay?
Yeah, sure.
Perfect. Put your arm like this. Perfect. You can relax now. Just going to feel to make sure I don't feel any other lymph nodes that might be concerning. Any pain? It's very important to check also the armpits for a breast screening. Everything looks great. I'm going to check the other arm now. Good, so I don't see any inflammation. And I would also like just to check your breasts to see how they look, okay? And relax. So I'm just going to take a look. Any pain?
No.
Good, so the color is great. I don't see any issues that might be alarming. No lymph nodes on your armpit. Perfect. Perfect. So I'm going to check your legs now. I'm checking the legs now for any fluid retention. I'm also checking at your color. I don't see any bruises, any redness, no cuts. Good. So I'm going to check your feet right now. Is it okay if I remove the socks?
Yes.
I'm checking your toes first. I'm gonna do some toes spreading. Make sure I don't see any eczema, any dry skin, psoriasis. I'm going to check this one. Just checking the capillary refill. It's within 2 seconds. Checking also the temperature to see if it's the same. Same temperature. Going to check the Babinski. Good. So far your feet, your toes are in very good condition. I don't see any issues. Skin is great. No eczema. No dry skin. Everything looks fine. So I'm not concerned about your feet. I would like now to check your back, and then we're gonna see the findings about this exam. Okay, Andrea, so I'm checking your back right now. I do like your skin now. It's almost clear, so looks like the treatment that you are using is working. Your skin is very soft to touch, so I'm so happy that your skin is doing better.
Thank you.
Any issues on your spine? Do you feel any pain?
No.
Checking your spine. You know if you feel something while doing this. Checking for temperature, any changes in temperature, but seems all right. I'm going to tap. You still have some marks, but otherwise your skin is improving a lot. to take some measurements of your back. Good. I'm going to do some sensory tests. Tell me if you feel these brushes on your back.
Yes.
Do you feel both brushes?
Yes.
No?
Yes. 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 Yes.
Tell me if it's right or left.
Right. Left. Both. 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 Left. Right.
Good. Tell me, how does this feel?
Cold. Cold.
Do you feel this cold all the way down?
Yes.
No?
Yes. Yes.
And how do you feel my touch?
Oh, warm.
How do you feel my touch?
Warm.
How do you feel this?
Cold. Cold.
My touch?
Warm. Cold.
Perfect. Tell me if you feel a vibration on your spine.
Yes.
Do you feel it now?
Yes.
Do you feel it now?
Yes.
No?
Yes. Yes.
No? Tell me when it stops.
No. 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 No.
Good. You can stand up now and we're going to discuss the findings about this examination.
Okay.
Thank you, Andrea. So I'm done with the exam for today.
Okay.
And I have good news. So everything was normal, all right. I didn't find anything suspicious. You don't have the lymph node that you was concerned 2 weeks ago. And it's probably because you had that infection, the flu. And regarding the scalp, you do have some flakes. So otherwise, everything is great. So I'm going to send you also to the lab, like I said now, to make sure we have your test results. And call you in the morning because the swab will be ready and also the blood test results. And I can tell you more about the results, okay? So far everything is good. And just wait for my call tomorrow morning.
Okay, thank you so much.
Any questions
No.
that you want to address? So everything is clear?
Yes.
Okay, so just wait for me here. I'm going to give you the referral and I will call you then in the morning.
Okay.
Thank you. Bye-bye.
Bye.
Hi, Elena.
Hello.
Thank you so much for coming today to the clinic. So I didn't see in your chart any concerns regarding the abdomen, but I saw you have some pain on the lower back.
Yes, I do have some pain.
Sometimes it can be related if you have some discomfort in the front or if you have any problems with the ovaries. I will check out your abdomen and then I will also check your lower back.
Okay.
I will start to put my gloves on. What I'm doing first is a visual inspection of your abdomen. Remember, you have this small, and I will check it out and measure it later. Otherwise, no rashes on your belly, no bruises, no cuts. I'm just checking your belly to see if it's symmetric, and the belly button is midline. It's very well centered. So I'm going to start to listen now. So I have very active bowel movements. This is normal. I'm going to gently palpate now, and then I'm going to do a deeper palpation.
Okay.
So just relax. Going to check for any distension of the abdomen. I'm going to see if the pain is related to your lower back. Just checking the temperature on several places on your belly to make sure I'm not missing anything. I want to check if the temperature is the same. Just a little bit slightly higher on the left. On the right too. But on the lower side of the abdomen. A little bit higher on the lower side. I'm going to do a deeper palpation. Let me know if you feel any pain, okay?
Okay.
Going to press a little bit to make sure.
Okay.
If I feel something inflamed.
It does hurt a little bit.
Hurts a little bit on the
On
left.
the lower side, yes, on the left.
How is on the right?
It doesn't hurt on the right.
Just checking the thoracic cage. Any other pain?
No.
Checking for any distension. Checking the umbilicus as well for any hernia. How bad is the pain from 0 to 10? If when I'm
6.
pressing down, it's a 6.
Yes.
So it's just when I'm pushing,
Just when you're pushing.
because you didn't mention any pain before, that's why I'm asking.
Just when you're pushing.
So when I'm pushing. Okay, so I will continue the exam, and in the end I will give you a referral for an ultrasound. I think it's better to check also with an ultrasound to see what's going on, okay?
Okay.
Going to do some measurements now of your belly. Okay. It was a 6. The same. About the same. I'm going to check now your belly for symmetry to make sure they are About the same on each side.
Okay.
It's gonna be a little bit cold, right? But
It's okay.
it's getting warmer. Okay. They are about the same on both sides. Just want to check the mold that you have here. I want to measure it to have it down in our records. So it's not elevated and the shape is very well defined. Just want to measure. I think it's like this, yeah. Good. So next I want to check some sensory tests, how you respond to some stimulus.
Okay.
You don't have to say anything right now. Tell me if you feel the vibration.
Yes.
Tell me when it stops.
Stops.
Do you feel it now?
Yes.
Do you feel this cold?
Cold. Yes.
Cold?
Yes.
This is a cotton pad and it's gonna be soft. Do you feel this?
Yes, I do.
Do you feel it on the right or on the left?
On the left.
No?
On the right. On the left. On the right. Left.
And how does this feel like now?
It feels sharp. 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 Sharp.
What does this feel like?
Soft. 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 Sharp. Sharp.
What does this feel like now?
Cold. 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 Soft. 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 Sharp. Sharp. Cold. Cold. Cold.
I'm going to percuss now on your belly and I will start with my fingers first. to slowly palpate one more time until you turn over and check your back, just to make sure I'm not missing anything. Still have the pain here?
Yes.
Just checking your back. Tell me, where is the pain?
My lower back on the left.
And so just on the left?
Yes, just on the left.
I'm also checking the temperature of your lower back. It's about the same. You do have another mole here. Did you see a dermatologist before?
No, I have never been to a dermatologist.
I'm going to take some measurements of your back. Okay. So I'm going to do some acupressure, and I will especially use it on the left side to see if we can relieve the pain a little bit. going to tap on your spine now. I'm going to do some sensory tests. Tell me, how does this feel like?
Cold.
No?
Cold. Cold. Cold.
And do you feel this warm or cold?
Warm.
No?
It's warm. Cold. Cold. Warm.
And how does this one feel like?
It feels sharp. Sharp. Sharp.
Soft
Warm. Soft.
or warm?
Sharp. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Soft. Sharp. Sharp. Soft. Soft. Cold. Cold.
Okay, tell me if you feel cold all the way down to your lower back.
Yes.
No? All the way down to the lower back?
Yes.
No?
Yes.
Still cold all the way?
Yes.
No?
Yes. Yes.
How does this feel like?
Sharp. Sharp. Soft. Soft.
Good. Tell me if you feel the brush.
I do.
Do you feel the brush?
Yes.
Do you feel the brushes?
Yes.
Both brushes?
Yes.
Left or right?
Left. Right. Right. Left.
Just going to use some acupressure here on the left side. I'm done with the exam for today,
Okay.
and I didn't find anything concerning. I will suggest an ultrasound for the belly, and we'll see if you have any infection or something else going on. Regarding the back, everything looks good. I just want to see if it's related or not. If you still have the lower back pain, we can schedule another appointment to check your back. But if you don't have any more pain, we can see each other in 1 year.
Okay.
So I will then schedule you for the ultrasound and we'll go from there.
Good.
Thank you so much for coming today.
Thank you for having me.
Take care. Bye-bye.
Bye-bye.
Hi.
Hello.
My name is Nurse April and I will do your exam for today. Thank you so much for coming in.
Thank you for having me.
So can you please spell your name?
Yes, it's Elena Gilbert.
Okay, and date of birth?
24 July 2001.
Okay. So can you tell me what's going on and what problems do you have?
I have some back pains. It's hurting me in the middle a little bit. Some neck pains here. And I have numbness here on my scalp a lot.
Okay, and from a scale to 0 to 10, how bad is the pain and the numbness?
It's like 6.
Like 6.
Yes.
Are you taking any medications right now?
No, I'm not taking any medications.
Any heart problems?
From what I know, not.
Diabetes? Asthma?
I do have asthma, yes.
You do have asthma?
Yes.
Any family history that I should know?
No.
No? And are you taking something for asthma? Any inhalers?
Yes, I do have an inhaler.
Okay. Any headaches, migraines?
I do have sometimes some migraines, but they're mild.
Mild.
Not that bad.
Okay. Any other problems regarding maybe the taste or smell?
No.
No?
Not.
Any hearing problems or
No.
no? How is your vision?
It's pretty good, yes.
Good?
Yes.
So when did you have the last eye exam, do you know?
It was probably 2 months ago.
Oh, so recently?
Yes.
And what the doctor said?
He said it's good.
Everything is good?
Yeah, no problems.
Okay. Do you smoke?
Yes, I do smoke.
Do you drink alcohol?
No.
That's good. Okay. Any flu-like symptoms in the past 2 days?
No, I didn't have any.
No. And did you had any accidents?
Yes, I did have a car accident 5 years ago. I broke my arm, but it's okay now.
So you feel good?
Yeah.
Okay, so I think I have everything in order here. I ask you this question because you're a new patient and I wanted to have this chart. So I will take the vital signs first and I want to check the cranial nerves.
Yes.
And of course I will check your spine and your neck in the back, okay?
Okay.
Do you have any questions?
No, it's all good.
Okay, so I'm going to put my gloves on. So I forgot to ask you for how long do you have the symptoms?
For about 2 weeks.
2 weeks?
Yes.
And the pain is constant or it comes and goes?
It comes and goes. Some days it's better, some days worse.
I'm going to take your, just keep your head straight. I'm going to take your temperature. It's 36.8 in Celsius, so it's good you don't have a fever. It's going on the index finger. This will tell me the oxygenation level. It's 96 percentile of room air. And I'm also going to take the blood pressure and I will listen to your heart and lungs. Is that okay?
Yes, it's okay.
Is this arm good?
Yes.
Sorry. Okay, so just relax your arm. So blood pressure was 110/65. Okay, and I'm going to check the wrist, the pulse. It's nice and steady. I just want to compare with this one. So just relax. Perfect. Okay. So I'm going to start and I will check your mouth. So you can just say and open your mouth. Okay. Everything looks pink, moist. I don't see any throat problems. Perfect. And I'm going to check your reflexes now and I will start with your face. So you can close your eyes if you want and relax your jaw. Just relax your jaw. Good. Tell me if you have any pain. Good. Okay. And I will check your arm, so just keep it like this. Perfect. Good. I'm going to check this one. Okay. So just stay like this. And I will check your knees as well. Okay, perfect. Okay, Elena, so I'm going to check your pupils now, the ocular nerve, and I'm going to come very close to your eye. So try to keep straight through the wall, okay?
Okay.
Good. I'm going to check the other one. So pupils are round and reactive to light. That's perfect. So now I'm going to ask you to close one ear and breathe to the other one. I want to see if it's not clogged. So just close one ear and breathe. Good. And switch. It's a little bit of congestion maybe.
A little bit, yes.
But I will do the smell and taste, okay? So just try to identify what it is, okay?
Okay.
You can take a deep breath in
This is lavender.
Yes.
This is strawberry.
Yes.
This is apples.
Correct. And I think I have just one more.
This is vanilla.
Correct. And I will also check your taste, so I will put one drop inside your tongue.
Okay. This is mint.
Okay, so I will put 2 more drops, so try one more time, okay?
So this is lime.
Yes, it's correct. So now I would also like to see how you respond to some stimulus, some sensory tests. Did you had this test before?
Yes, I did.
Yes.
Yes.
Okay. So this is a sharp object. So let me show you. This will be sharp,
Yes.
and I will also combine with cold temperature. So this is a globe that it's cold, so you can check. It's cold, and this is dull and it's soft. Okay. So just try to relax, close your eyes, and I will use these objects on your face, on your arms a little bit. Okay.
Okay.
Perfect.
Sharp. 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 Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. 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 Dull. Cold. Dull. Cold. Sharp. 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 Dull. Sharp. Cold. 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 Dull. Sharp. 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 Dull. Dull.
Okay, perfect. You can open your eyes. And since we're talking about the sensory test, I also want to do one more. So this one is going to do a vibration. And I will ask you to tell me when you don't feel it anymore, when it stops, okay?
Okay.
Good. So do you feel the vibration now?
Yes.
Tell me when it stops.
Stop.
So you can close your eyes now.
Stop. Stop. Stop.
And I will... Do you hear the vibration?
Yes. Stop.
Do you hear it?
Yes. Stop.
Good. And tell me what position it's louder. So this is number 1, this is number 2.
Number 1.
Good. Number 1, number 2.
Number 1.
Perfect. Okay, Elena, so I will listen to your lungs now and heart, and then you can lay down on your belly. Good?
Okay.
going to listen with the bell. Take a deep breath in now. Hold it for 3 seconds. And you can exhale. Good. Take a deep breath in now. Hold it for 3 seconds. And exhale. And I'm going to listen to your lungs now. Take a deep breath in. Exhale. One more time. Perfect. I'm going to come on the other side. Take a deep breath. Exhale. One more time. Perfect. So normal sounds of the heart, I heard just S1 and S2, no murmurs and no infiltration of the lungs, so that's awesome. So now I will ask you to lay down, like I said, okay?
Okay.
Perfect. I'm going to check your spine now. You said the pain was more in the middle and here on your neck.
Yes.
Let me know if you have some pain here on the lower back. Does it hurt if I do this?
No.
Now?
No. There. It hurts.
Here in the middle?
Yes.
Just checking if you have any deviation of the spine. What about here?
Yes. It hurts.
It hurts?
Yes. It hurts. It hurts.
So you have a slight deviation here in the middle that might cause the pain. And here you have a small inflammation. It is okay if I remove the necklace?
Yes.
Okay, so I'm going to check your scalp now. Just gonna part your hair and try to do it in the middle. going to do some sensory test. So tell me if it's sharp or dull.
Sharp. 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 Sharp.
And how do you feel my touch? Do you feel it sharp or dull?
Dull.
How do you feel it now?
Dull. Sharp. Sharp. Dull. 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 Dull.
And how do you feel this? Do you feel it warm, cold?
Cold.
No?
Cold.
No?
Cold.
How does it feel like now?
Sharp. Sharp.
Okay. And I have some sensory brushes. Do you feel them on both sides?
Yes.
Now?
Yes.
And what side do you feel this?
Left.
What side do you feel this?
Left.
Now?
Right.
Now?
Right.
Now?
On both.
Now?
On both.
Okay, Elena, so I'm gonna use a tool that it will help you with the inflammation. So I will use it on different trigger points. Perfect. I'm going to use a spray here, if that's okay with you. That will also help you.
Okay.
So it will be a little bit cold, but oops. Perfect. And now I'm gonna use the gua sha and I will give you a massage here on the back of the neck. If you have, if the pain is very bad, just let me know.
Okay.
Okay, Helena, so I'm done with the examination and you can stand up and we're gonna discuss the findings of this exam. Okay, so I'm done with the examination and I have good news. So I didn't find anything abnormal. I did check the cranial nerves, the scalp, and you just have some mix of answers regarding the sensory test, but they are not so bad.
Yeah.
And anyway, I will check the records with the previous doctor. And if you still have these symptoms for more than a week or two, just call me and we can schedule another appointment, okay?
Okay.
Do you have any questions or concerns?
No, no questions.
No? Okay. So, thank you so much for coming and I will see you then next time.
Thank you for having me.
Thank you. Bye-bye.
Thank you. Bye-bye.
Next person in line, please. Hi,
Hi.
how are you?
I'm fine.
Can I see the passport?
Yes.
State your name, please.
Andrea Gray,
And date of birth.
December 1st, 1999.
Okay, just come a little closer. Is this yours?
Yes.
It's weird because you look very different in the picture.
I know.
Like, how do you know?
Because I had a surgery.
You had a surgery?
Yes.
Okay, so your hair is blonde here, and looks like in the passport I see you have dark brown eyes, and now you have blue eyes.
Yes.
Do you have contacts?
Yes.
Traveling a lot?
Yes.
So you like to travel?
Yes.
Where did you came from now?
Austria, Vienna.
So what did you do in Austria?
In vacation.
Vacation? How long did you stay?
2 months.
2 months.
Yes.
Do you have a family or in
Friends.
Austria? You have some friends.
Yes.
And are you traveling alone or with your friends?
Alone.
Alone? And where are you going now?
To New York.
New York is your home?
Yes.
So your eyes are blue and your face looks very different than the picture. You said you had a surgery. Anything suspicious? Any drugs?
No.
Firearms?
No.
Guns?
No.
Are you sure? Any other illegal substances?
No.
No?
No.
Okay. Miss, let me check the database and the passport because it's something weird. The first time when I see this problem, you look very, very different than the picture. So I have to check. So hold on for a second.
Okay.
So did you hear the beeping sound?
Yes.
So we have to do a pat down. You are very suspicious passenger right now. I have to check your bag, and in the meantime my superiors will check everything what we can find about the passport.
Okay.
And we have to investigate a little bit more, and until then you try to remain calm, and I have to do a TSA pat down.
Okay. I don't know why, because we have this problem again, and I want to go home.
I mean, it's the first time when we have this problem actually, because you look very different than the passport. Maybe you've been pre-selected before for something else, but we have to check better the passport. Do you have also an ID with you, driving license, so we can check better?
Yes.
What do you have?
Yes, I do.
You really do?
Yes.
Okay, can you give it to me?
Yes.
This is your ID?
Yes.
It's kind of big. I'm wondering if it's fake or not.
It's not fake.
Oh, and by the way, the ID is expired. So I don't know what's going on, but I also will keep the ID and we'll do the pat down. I don't know what's funny, but yeah, thank you. Thank you for being calm, okay? And respectful with the officers in this place, okay?
Okay.
In the meantime, I will put my gloves on. I need to check your phone.
Okay.
I have to check your bag, so we'll put it on the side. And I will start the pat down. If you want to tell me something now, you can tell me.
Okay.
If you have any problems, any conditions, just let me know, okay? Do you have any of this?
No.
No?
No.
Okay, so can I have your phone? I will put the phone on the side. And the backpack on the side. And let's see. Just making sure. Can you just slowly turn around? Just stay like this for a few seconds. Turn around again, and we have to remove the jacket, so if you can take it off. Okay, we'll put it close to the backpack, and I will start to pat down on your upper side.
Okay.
And I will check your hair as well. Just relax. Nice bracelet.
Thank you.
Okay. Okay, just relax. I'm going to check your waist. Something here. Okay. Can you slowly turn around? You're so quiet now. Are you afraid of anything?
No.
No?
No.
Are you sure you're nothing to be afraid of?
I'm sure.
Okay, turn around. Miss, so I have to check your hair as much as I can. So just try to turn your head on the right. You have something black in here. Hopefully it's not the lice. Did you have a problem with the lice?
No.
Are you sure you didn't have problem with the lice?
Yes, but
I mean, it's very common and you never know.
right.
We have to keep everybody safe, so making sure you're not spreading anything.
No.
Because I saw something black in there. Okay. Would you mind if you turn around so I can check the other side?
Okay.
You do have some dandruff, but I didn't see anything black or suspicious on this side, so let's check behind the ears. You have something black again. I'm sorry if it hurts a little bit, but I just have to do my job. And making sure everyone is safe. Just relax, ma'am. Okay, and just going to put my fingers as much as I can to make sure you're not hiding anything. Ponytail, it's so tight. I want to make sure I'm not missing anything. Making sure that you didn't do that on purpose. Okay, I guess you can turn around now. Okay, so I'm checking your pockets. Anything?
No.
Your pants are a little bit large, so... Can you turn around, please? Anything in here?
No.
very tight. You can spread your legs a little bit. Go ahead, you can turn around. Can you remove your shoes, please?
Yes.
Are these Converse yours?
Yes.
These are new?
No.
See this one? Okay, and your socks, can you remove them? And stand up, please. Just have to inspect your toes to make sure you're not hiding or putting something in between the toes. Just relax your toes. Okay. Just want to make sure. Can you stand now in one foot? Are ticklish?
Yes.
Just a few more seconds. Just want to make sure everything is all right. Don't hide anything. Good. Can I have the other one stay in one foot? Okay. Are you comfortable?
No.
Yeah, so I'm sorry, just for a few minutes. sure you're not hiding something. Good. You can relax and take your socks, your shoes, and we're going to check your backpack.
Okay.
So is this pink backpack yours?
Yes.
Let's see. That's all you got? You have any problems or
Yes,
condition?
I have asthma.
You have asthma?
Yes.
This is the inhaler.
Yes.
Some medications. What's this? Lindo.
For skincare.
Skincare.
Yes.
Are you using this?
Yes.
Has multiple lights. Red light, pink, blue. Interesting. Some clothes you can keep them for a little bit. That's a spray. That's 2 ounce. You're lucky this is fine. You have some thickening spray.
Yes.
What's in here? Oh,
Makeup.
powder.
Powder. Yes.
Are you sure it's real powder?
Yes.
Or it's
You can smell.
some kind of other powders?
No, it's powder. For my hair.
Okay, I see other products. We're just going to test the powder. So just stay here for a few seconds. You're very lucky, miss, today. It's real powder for your hair. Anything else? Oops. I'm going to put this back. And yeah. So I guess everything is fine. And yeah, I guess you are very lucky today and you are good to go. How do you know?
No.
So yeah, take your backpack and take this, your phone
And passport.
and passport, and as far as the ID, make sure when you go home you replace this one. Sure. Because it's expired. And yeah, that's it. Take your passport as well.
Thank you.
Bye-bye.